So now we have left with the two options, two things to do. One is honoring our most beloved chairman, Shri Ajay Mishra garu. Last but not the least, a man who is honored should say a few words about his experiences. Last, don't get fed up, don't run away. He is a kind man. He'll address you very shortly. With due respect, sir.
Friends, how to put it, I am thankful to Dr. Murthy, but I sincerely don't know why I am being honored. See, no, because normally you honor someone when he does something. And at least I have not done anything great or anything significant for ACT now. And I can tell you the same thing I told to my wife before coming here.
Yes, sir.
She asked me कि why are they felicitating you? देखिए वो हर बीवी पूछती है अपने हस्बैंड से तुम कुछ नहीं करते हो उसके बाद ये क्यों हो रहा है? But then I told her also I don't know what I am doing, but since they have asked me to come, so I am going there. But sincerely thanks to ACT Now and Dr. Murthy for honoring me here. And I think it is more because whatever I'll put, the way I've been interacting with people, with friends, many times with strangers also. Strangers I'll put whom I have not met substantially, even though the way I meet. I would take this opportunity to brief some things about Red Cross. Many of you are doctors, you must be knowing. But for those who may not have adequate exposure to Red Cross activities, see, first of all, Red Cross Hyderabad does quite much work. We may always say that they are not doing, but today is 2 days back we have got the information. Tomorrow is 17th, Tuesday. We have the national meeting of the Red Cross Society, and in that Hyderabad chapter is being provided the gold medal for the services which they did during COVID time. And I don't have any contribution to it, very frankly, because I have joined only 1.5 months back. But the kind of work they have been doing, it's not fashionable, it's not popular, so newspapers rarely report that. That's a different thing. For example, last week, some 10, 12 poor people from Haryana were here. They didn't know what to do. And somehow the information came through Haryana governor, who is from Hyderabad here. And they were assisted by way of food, some basic lodging, so that they can go back where they wanted. Similarly, the main activity is blood donation, blood camps, and blood storage facilities which we have. Here in Vidyanagar, we have a quite modern, with updated machines facility. The amount of blood which we take as donation and distribute later to the government hospitals and few corporate hospitals, because many of them have their own blood banks, is about more than 50,000 units of blood. Last year we did that. 50,000. It is, other smaller blood banks in the private sector, they claim much, but that is a Red Cross activity for the state, I'm telling Telangana state. Along with that, what I was impressed in the last 1.5 months is regular treatment of thalassemia patients. Doctors must be knowing it, but because few are non-doctors. See, thalassemia is a blood disorder and it requires transfusion every few weeks, 2-3 weeks normally the patient requires for life. Thalassemia. Thalassemia. So the 3 centers in the state, Warangal, Hyderabad and Mancherial, they give blood transfusion to the patients free totally for about 1,000 patients every month. 1,000 patients. The Hyderabad blood bank in Vidyanagar caters to about 500, and Mancherial and Warangal 200-300 each. And I have seen the patients, the doctors know, see what kind of stigma, neglect they undergo. It is total free. Many a times we provide transportation also to them, and basic healthy food for that day. Then they go back, and it's regular monitoring which is being done through our volunteer doctors. We call them volunteer because some of them are paid, but the payment is much less than what it is in the market. So thalassemia patients is one thing which I feel should be increased, and I'll be taking steps to increase it, naturally with support of all of you. Then there is another activity which blood bank, which Red Cross has taken, is generic drug stores. 18 drug stores, generic drug stores, are functioning in this state, sir. I have visited few of them, not many. So that also we are planning to increase. But then yes, as many of you know, we have to do outreach work through our volunteers with at least the government doctors to start with, that they should start prescribing the generic drugs, because many of them prescribe the popular brands. Next, I have not visited till now, that is my pace of working, one can call it. But there are 3 hospitals, smaller hospitals, which are run by Red Cross. One is in Mohammed Guda, Secunderabad, Dr. Paul Dawes Maternity and Family Welfare Center. In Raniganj, we have Lady Burton Maternity and Family Welfare Center. In Boinpalli, we have Misri Lal, Mangilal Maternity and Children Hospital. So these, and Gaddi and Naram also we have Rehabilitation Palliative Care Center. These are approximately 25 to 30 bedded hospitals. Naturally, free treatment or at very subsidized rates where the treatment is costly. With the basic doctors, volunteers, how they have to be improved. I will come up with my plans and suggest and invite suggestions from many of you who are much more senior in this profession. So this will be, say, because these facilities are provided mainly 99% to poor people. How do we get money? That will be one of your answers. We get some government grant which takes care of about 155 staff, I'll call them. But this staff also, we don't call their wages as salaries, because then they have to fall either into the government scale and all that bureaucratic this thing. So the salary component is about 4 crores something annual budget. Government gives us 5.5 crores approximately. Balance about 8 to 9 crores we get as pure donations, sir, during the year. It was news to me. And the day I joined, it was nothing to do with my joining. 2 individuals came. I don't even remember their name, to be frank. One gave 3 lakh rupee check without asking anything. Another gave 5 lakh. So with one I asked, why are you giving this? Because natural. And I said, I'm asking. So we also have one more activity, that is providing the not home care nurses, but home care assistants. Home care assistants to the aged patients. We have a tie-up with the GMR. They first give them basic training. They select them, and then they come to us for orientation training for about a month, and then they are sent to wherever they are required. And naturally, since Red Cross is doing it, the salary which has to be given to these assistants is much less. It's about 15,000 rupees presently per month. plus shelter and bed, and 5,000 is some, say, one time this thing. So one of the beneficiaries, the patient's son, he was happy with the work of this girl, and he came and donated 3 lakhs. So see, that is how, I'm saying that is how we get funds, see. And I went to the MC managing committee meeting of Hyderabad town or city. There are 2 members, I think both of them are doctors, around 70 years. They gave 1 lakh each on that day. And they told also it is not money from our kids settled abroad, it is our money. That also. So, plus corporates also help. One corporate gave last week one advanced life support ambulance for use in that area, which costed, after bargaining negotiation for them, more than 30 lakhs. So that was given free to us. And naturally, that's the way Red Cross operates. One of the activities, I think, which Ashish Chauhan told, is we are venturing into the old age home co-management, I'll call it. There's a Government of India scheme where the Government of India provides funds for construction of old age home, 50 lakhs. Rest is to be borne by the state government or the NGO. Then for 25 to 50 bedded old age home, the government will provide 70 to 75% of the running cost. The NGO has to put in balance 25 to 30%. So when the first meeting took place with the government officials, because government has to identify the NGOs in 10 districts, 11 districts. So that's a big procedure for a government to select which NGO to give this work, whether they are. So they naturally face problems, allegations, all kinds of things will be there, political requests and all that. So the commissioner said, we want to give it to Red Cross, how many you can take or how many you can run? I said all 11. So the kind of relief which I saw in her face when I say all 11 we can run. And I don't know much about our resources. And it means approximately 1.1 crore worth of financial commitment on behalf of Red Cross also. I only asked one sentence from my General Secretary. He is a retired person who works for the Red Cross. So, will we be able to manage this much funds, 1.1 crore? He said, yes, sir, we'll manage. So, I don't know how he'll manage, because he is full-time there. And, the General Secretary is at one level a paid job, but at another level it's not a paid job, because I asked him and told him he takes only 20,000 per month. Can you imagine? And he's a retired DRO, Senior Deputy Collector. He's also doing it out of passion, out of social work, all those. So this is how Red Cross operates. And what I'll be doing is, naturally it goes without saying, to have partnership, alliance with many organizations who are in this field. Some of them I know, many I'll come across in the days to come. So that is from the Red Cross. I will narrate one incident to Dr. Pavitra. You are there now. Phone call coming to you at, the serious business is over now. Huh? So phone calls coming at 7 o'clock. I got a phone call now 26 years, 27, 28 years back at 6 o'clock in the morning. My working hours used to be, because of different things, working come socializing, I'll put it. I was in the district up to 12:01. I used to play with my daughter around 12:30 to 1:30 was my time to play with her at midnight. That was the only time I used to get. So at 6 o'clock the phone call comes, and those days the mobile was not there. So the person in the camp office will pass on the call to you. So next to my bed, the bell is ringing at 6 o'clock. I am half awake, half asleep. I pick up. He immediately says, CM sir, CM sir. That means CM is on the line. At 6 o'clock in the morning, CM is on the line. What do you do? And once the attender has passed on the call to you, you can't say also that you will take 5 minutes. I take the call. And immediately within 5 seconds, the CM is on the line. CM was asking about different kinds of schemes. I was telling some numbers. Even in spite of that, the CM was telling percentage, your percentage has to increase and all that. Fortunately, I didn't commit any blunder. And after 20-25 minutes, the call was over. Okay, Ajay, I'll ring you up again whenever. After that, I was angry because why should anyone call me up at 6 o'clock without an CM's call? So I rang up the CM office again at that time at 6:30. Whoever was I know, but I spoke to the principal secretary to CM. I said, "Are you angry with me? Your office, CM's office. You want me to be transferred or something?" No, nothing. CM is happy with you. I said, then why this call at 6 o'clock without, you could have told me 15 minutes before. Yes, then you, put me on the line. No, nothing like that. So then I said, you know what you had, briefed the CM and all that. And what was there with me? So he said, what? I said, you had produced the data sheet of my district before the Chief Minister. So that's how he was, questioning me all the things, and he was, asking me questions. So I said, you had data sheet before the CM, and do you know what was with me? He said, what? I said, I had only bed sheet with me to rely upon at that point of time. So anyway, after that, I told them, listen, unless you are angry, don't ring me at 6 o'clock. And for, I think, 2 years after that, I was in the district, and no phone call came to me. Other collectors suffered that. And now I can, at that time also I told only few people, and this joke kept on circulating. This happened, I think, 94, 95. And this joke was told in 2002 to my wife in Chennai, that one officer told like this to the Chief Minister. But then, I am not advising you. Like it happens in the TV commercial, no? These are tasks performed by professionals. Do not try at home. So, no, 6 बजे आया था मुझे 6 बजे मुझे आया था तो so then I'll tell a personal this thing about the youngsters not having kids and all that. My daughter and my son-in-law, when we talked to them about having a family and child, they said, no, we require this much money before the child has to come. So, and 2 years back, some calculation, they said 20 lakhs has to be there in their bank account, then only they'll plan. Then we said, hey, what is this? Had we thought, you would never have been there. Yes. Even at that time, not even 20 lakhs. And they had a calculation, even some, I don't remember the technical thing, some genetic thing to be preserved and all that kind of. So the kids have a different mindset. And COVID experience, I will tell you, the positive side of COVID experience, which I don't know, for some of you, it may be repetition. Myself, my wife, my son, who is a doctor, junior doctor, and the fellow working at home, all four of us got COVID at the same time. And also, out of 3-4 people working at house, 2 people got it. Out of 2 drivers, my wife and my 2 drivers, 1 got it, 1 security fellow got it. So that was the scenario. So no one came to home because they can't come home. Only 4 of us were there inside the house. But we were fortunate that 1 servant boy was also there. Those were the only 14 days when myself, my wife, and my son met at least 2 times on the dining table. That day in July 2020 and today, we have never met twice on the dining table, either before or after, because of our own nothing against each other. After that, maximum if we meet once on the dining table, that's an achievement. So, COVID has many positive things also, I'll put it. And, many people jokingly say when you are in the COVID, this thing, there are, Dr. some, I'll put it, fear, panic created. Because my wife suffered COVID second time after a few months. As a, whatever you can say, confidence building, some isolation effects. Myself and my son used to be in her room for at least 20-25 minutes every day during those 14 days. Okay, we were not sitting on the bed, we were sitting at a distance on the sofa and all that. And we told her, don't sit on the sofa when we are not there. Precautions were taken. But see, the way treatment was done, the way panic was there. See, I am not undermining the seriousness of the COVID, because much was not known initially. And gradually, even doctors came to know about this thing. So COVID has its positive this thing, and I think 22 is a good year. We are over with COVID almost, I'll put it. Though, see, some news keeps on coming. So with this positive note, I'll say, once COVID is down, so more opportunity for all of us to move out to the public, to do whatever social work we can. And thanking ACT Now and Dr. Murthy and all the directors and senior people for coming here and sharing my happiness. Thank you.